I like to think that I work hard. I suspect that most of us do. I'm blessed to be able to work here with you and to try to work for the common good. I enjoy this work most of the time, and I believe in the dignity of work. I understand the attractions of this legislation if it was viewed as a benign inducement to work. I induce people to work all the time, after all, my employees, my children. The difficulty I have with today's legislation is not with the virtue of work. Rather, what I object to about this legislation is what we use as an inducement to work, why, and how. This bill proposes to withhold health care from our fellow citizens to induce them to work. Brothers and sisters, let me be clear. I fully believe that health care is a human right. Our ability to care for one another takes no more foundational form than the care that's represented by health care. I know that we made a bad Faustian bargain in the 20th century to tie health care to employment. I also know that it doesn't have to be this way. We stand alone among first world nations in doling out health care, not according to need, but according to wealth. Today's legislation is doubling down on a bad linkage between health care and employment, and uses health care not as a tool of compassion, but of coercion. Why is this legislation in front of us? We already have a tool to induce work in America. It's called a fair wage. The bill's author told me and my fellow committee members this morning that this bill's purpose was to address a labor shortage in Michigan. As I already pointed out in committee, we don't yet have a wall around Michigan. In a free market and with a mobile labor force, the proper response to labor shortages is to offer increased wages, not to coerce people by threatening their lives and their health. It's hard to see this legislation as anything other than the second initiative this afternoon designed to suppress wages. Finally, the how of this legislation should give pause to anyone with a real commitment to small government, regulatory frameworks, or efficient markets. This legislation will create a Frankenstein monster to monitor and coerce inefficient choices at terrible costs. Estimates for the cost of following citizens around and monitoring their compliance with this law range from tens to hundreds of millions of dollars. Moreover, for all that we may try to craft exemptions, we won't get it right. The Frankenstein monster enforcement that we create with this bill is blind to the value of caring for children over 6 years old. It's blind to the value of elder care by family members. It's blind to mental health challenges that don't rise to the level of full disability. This enforcement zombie will crush the food service worker whose hours are cut at the last minute on a slow shift. It won't care if someone can't get hired because of a criminal history that follows them from job application to job application to job application. The beauty of a free market and a market-based economy is that a job market which is based on wages and choice, not coercion, allows efficient choices to maximize welfare, and it lets individuals and employees, not the government, make those decisions. Work for wage is choice. Work for life and health is not. We all in this chamber get health care so that we can be healthy in order to work. Please don't vote today for a state in which the poorest and most vulnerable of our fellow citizens will have to work in the cash economy in order to stay healthy.